Most hockey players think that they need more stretching because their hips feel tight, since they can't rotate into their inside edge and their hip feels pinchy. This so-called tightness isn't because the muscles are short necessarily. It can be from the hip having an inability to access true internal rotation. If the body can't access true internal rotation of the hip, it will then compensate for this issue, affecting the knee, ankle, foot, and potentially lower back. Hockey demands true internal rotation, since it gives us the ability to access inside edge control, smooth transitions, and better crossovers. This drill has been one of the most effective ways to reset your internal rotation of your hip, and this is how to do it. All you need for this exercise is a double stacked pillow or a small foam roller and an object that you're able to push your foot into, like a box or a yoga block. You're going to lay down on the affected hip and you're going to make sure that the top of your shoulder, top of your hip, and the top of your foot are in alignment with one another. The top foot is going to make contact with the wall just slightly in front of the hip. The bottom knee is bent less than 90 degrees and you're going to have a foot contact with the box or yoga block so that we're able to push our pelvis into that side. You want to have a 2 out of 10 pressure with the bottom foot against that block. Make sure your pelvis is neutral. How you find this is you tuck your tailbone underneath you and you extend it and you try to find somewhere in between. Getting a double stacked pillow and putting it underneath that bottom knee. If you get that pinching sensation in your hip, that means that the pillow is too high and you want to lower it. If you don't feel a stretch in the back portion of your hip that's on the ground, that means that it's too low and you want to elevate it. From here, you want to press the top leg into the wall, turning your pelvis in towards that bottom knee. You want to move your hips and shoulders as one unit. What you want to feel is a contraction at the top hip and a stretching at the bottom hip. You want to breathe through your nose for 2 to 3 seconds and you want to exhale through your mouth for about 5 seconds or more, like you're fogging a mirror in front of you. Repeat this position and breath cycles for 2 sets of 10 repetitions. And what you should feel then is better internal rotation of that hip.